Hi, thank you very much for your busy schedule joining us on, this program. I think the reason why I generate this program, just want to give you a story because I found that a lot of the people who are, even though not serious diabetic, they start getting few things that even pre-diabetic have this already has starting that issue, but not as prominent. They start getting a little numbness and they got less feeling in the lower foot area. So net result of that, they would say, wow, is it really actually able to, really at the end of the day, can they, is it really the nerve damage or what? A lot of people have asked that question. And that's why I create this lecture to everybody understand. Hi， 各位堂友，我係 Andrew 啊 ，Andrew Lau 啊，我係 Lowsutea President。好多謝你星期六都你嘅繁忙時間都嚟 join 我嘅 webinar， 大家了解。其實今次咧點解我做呢個 webinar 好特別嘅，因為好多堂友話俾我聽，有啲前期患病者堂友都有嘅。佢話隻腳好似冇乜感覺啊。咁我話哇，係咪真係冇乜感覺啊？原來真係會喎，因為咧，如果你係堂友嘅話咧，好多時咧你開始係有一個好短暫嘅。已經係有個神經嘅損毀，所以變咗嚟講咧，呢個堂咧可能會幫助好多嘢咧，令到你係更加了解係點去防禦呢樣嘢。Okay, so today I thought that maybe perhaps give you this webinar to help you better understand what is the key issue with the nerve damage, and that can be a very important things you need to start acting on. And prevention, because if you can do that, that will help you tremendously. So what I'm going to do is I'm going to now share the slide to you guys, and then go from there. 各位堂友，多謝你嘅參與啦。咁我現在咧就會係開始咧係去講我哋講座。咁大家了解點解今日個講座咁重要 ？OK 好嗎 ？OK。Okay, so I think everybody can see the slide. I hope if you can see the slide, give me, okay, good. I think can the Zoom people can give me a yes. Okay, good. You can see the slide. And Facebook, I presume you can see it too if you see a Lowsutea, okay? So today, why type 2 diabetic feet go numb? And we want to get you a better understanding, have a real in-depth understand, and you can able to prevention. Plus, there is a real good recipe called fluffy waffle, which is only get 3-gram carbs, help you lower your sugar, and on top of that, it's delicious. And that's why I want to make sure you get that. Because a lot of clients say, wow, I'm diabetic and nothing to eat. It's not true. You can eat a lot of good stuff, and we'll give you very good recipe. All my recipe are simple to make. All you do is just put everything together and cook it. That's it. OK。咁各位同學，多謝各位去今日嘅參與啦。咁其實我哋講咗啦，點解我做呢個講座咧？因為好多堂友話俾你聽，隻腳開始有少少感覺唔係咁sensitive 啊。咁唔係咁 sensitive 嘅時候咧，點解會咁咧？就算係前期患病者都開始咧喺腳板底唔係咁 sensitive， 咁呢個係要留意嘅。咁同埋今日咧做個 waffle 咧俾大家食啦。咁嗱，咁 before 開始之前咧，我都講下咩嘢叫做糖尿病。個原因咧，好多堂友咧都唔知道咩叫糖尿病嘅時候咧，咁我哋就要好快脆係 catch up。咁今日好多謝有好多個堂友今日傾偈嘅咧都喺度啦。咁有啲堂友話咧就聽到咧，佢話你 repeat 多幾次咧，我就入腦多啲嘅。咁其實係啱嘅。個原因好多時候聽咗之後好似記得，但係遲啲又唔記得咗。咁當你聽得多咧，你會用咗深入腦啦。咁你就以後一聽咗之後，係喎，我要咁做喎。咁記住咧，係糖尿病永遠唔好嘅，你只係能夠控制嘅啫。咁控制咧，其實飲咗糖我哋去糖茶咧，你見到血糖係好鬼正喎 ，A1C 落6啊5.幾喎，但係你要繼續用你嘅 A1C， 唔係話你會痊癒嘅，其實你係只係控制嘅啫。Now keep in mind, diabetic cannot get well. All you do is act your only control. Now, the thing is this, a lot of people don't realize that. They thought, well, okay, I get well now because my A1C dropped down to 5.8, 5.9. I'm pre-diabetic, so I don't need to do anything. So I can able to not to drink the tea. I don't have to exercise, not dieting. Guess what? Boom, your A1C will go back up to 6, 7, 8. And that happened all the time. And I have a lot of diabetic. My client had come back and said, Andrew, I don't know why, you got me well. I was now already 6 or 5 point something, and now my A1 is 8. And I said, what do you have done? Oh, they find out that they didn't drink the tea, they didn't do exercise, they don't have a diet, or they're losing the effort, and they are start all over again. 因為各位糖友咧，真係記住咧，原來咧，即係糖尿病係唔會好嘅。你飲咗茶，就算你 A1C 去到5.7，你都繼續係要飲茶。又繼續做 exercise， 繼續diet， 呢個係永遠係咁嘅。咁記住咧，就算你 A1C 係跟到6.4，你都係要繼續好多 effort，OK？ 咁你點樣控制血糖啊？最緊要 diet 啦，最緊要唔好食白粉啦，任何白粉唔好食啦 ，weight management 啦 ，exercise 啦，度血啦，同埋咧聽講座啦，多了解啦。咁最緊要飲去糖茶啦。嗱，呢個係一定要係咁做嘅。其實如果唔係咧，你係好似我啲糖友咁個彈翻上去，又再由頭嚟過就好辛苦啦。So remember, when you are pre-diabetic or diabetic, the same. You have to control your dieting, you have to control your exercise, you have to go weight management, you have to not eat soda and not to eat any white powder, and you have to drink Lowsutea continuously to continue maintain your blood sugar level low, okay? And on top of that, Lowsutea is very good. It helps you lower your blood sugar, lower your cholesterol, LDL, and also lower your salt and also detox. At the end of the day, you end up will be lower sugar, lower cholesterol, and detox, and possible also even the decrease of blood pressure. So it's a lot of benefit. And how Lowsutea work, basically, there's guava leaves blocking sugar into your vessels after you eat, and bitter melon act like an insulin, take the sugar into the cells, and then they also dump the sugar out from urine and also salt out urine and the cholesterol through urine. So net result, you will end up will lower your cholesterol, lower your blood sugar, lower your blood pressure, and also help you detox. So those are a good benefit. 嗱，Lowsutea點去糖茶點做㗎？因為佢裏邊有番石榴啦，落咗啲糖入去血管裏邊啦。苦瓜好胰島素帶啲糖入去個細胞裏邊啦，同埋咧佢仲有喺尿嗰度咧係將啲糖拎咗出嚟，同埋咧鹽拎咗出嚟。咁你兩樣嘢都降低糖、鹽同埋 cholesterol 3樣嘢，咁變咗你咗鹽低咗咧，你血壓都降低嘅。我有一個糖友喺南丫島住啊，佢話俾你聽 ，Andrew 你飲咗茶咧，唔淨啲糖降低啊，仲有一樣好降低，我血壓降低，咁我藥血壓都少咗現在。咁佢好開心。咁其實呢個係即係常見嘅。咁咩叫血壓低啊？其實你要係 under 120度至你個上壓啦，下壓咧就係 under 80度，咁就叫血壓低，唔係14度，唔係嘅。So what is considered lower blood pressure? Your blood pressure should be 120 and lower. If you're 125, you have some more work to do to get 120, so you cut down on salt and so forth. And your systolic blood pressure should be between 80 and below. Now, you are 85, you have some more to work on. So it's best to get that down because that will prevent all your stroke or the problem. And if you don't actually well control, then your heart might be damaged, your vision can be damaged, and your kidney can be damaged, you can have a stroke, you have nerve damage, and poor circulation is all prominent here. And we will basically, actually, all the doctors now, they're all saying that, wow, your A1C is 6.5 and above. These are all the problems that you're facing. So keep that in mind. Always remember to keep blood sugar low, lower than 6.5 on your A1C. So that will help you to improve. 各位糖友記住咧，如果你唔控制糖咧，你要 damage 個心臟啦，你隻眼啦。你個 kidney 啦，你個腎啦，可能中風啦。今日我講 nerve damage 啊，咁啊同埋 poor circulation 咧。如果你係因為個血液唔係落到底下腳咧，你會真係 end up 會 be gangrene 啦。So if your blood circulation is bad and your nerve damage bad, you don't feel the damages and net result you may end up will be getting stroke. I'm not getting stroke, but getting injury, and you might get gangrene, as that's a very sad thing to have. I saw a lot of people getting gangrene when I was an ICU nurse because they have to chop up the feet, and the older person, 65, 70 years old, and the feet got chopped up. Some of them chop up the feet first. Actually, some people chop up the toe first. Eventually, chop up the feet. Eventually, got higher. They just keep going up. So really sad. I see a lot of these people. Sort of the feet get chopping away, and they have to be on a wheelchair for the rest of their life. Imagine that. Now, so really at the end of the day, high blood sugar is actually lead to all very serious complications. Keep that in mind, like numbness, pain, injury of the feet, and the leg doesn't heal well. All these are really at the end of the day are the very serious complications of when your blood sugar is high, okay? Because they continue damage and restricted all the vessels. And so numbness is the first symptom of your nerve damage. They call it a neuropathy. So it is really a first sign if the leg is getting numb. And I found it's not diabetic patients only, but also pre-diabetic. I felt that, wow, because I have now pre-diabetic patients come to tell me, hey, Andrew, my feet is not feeling as sensitive as before. And I noticed because they are now 6.4 of the A1C, they start damaging the nerve. So very important, you have to bring it down because that is the most common complication for long-term when your blood sugar start going up, especially for complication with poor blood sugar control and long-term with high blood sugar. What is the high blood sugar? Anything between 10 and 11 and up, then you will have. So this webinar will help you learn all that. 嗱，各位堂友，其實咧第一個咧，如果你糖高咧，一個好多數人有呢個問題咧，就係佢會係將你個即係嗰啲糖咧整到個成個腸嘅所有嘅神經系統咧開始損毀。咁你第一樣感覺咧就係嗰啲腳咧唔會 feel 咁多，唔係手啊，腳先嘅，全部腳先嘅。咁變咗嚟講咧，呢個咧就係開始嘅麻痹啊，或者冇咁 sensitive 嘅感覺啊。咁呢個係好 common 嘅，其實唔係淨係糖友有㗎，前期患病者都有。所以好重要咧，就將你糖降低，因為長期嘅糖係高咧，好似10啊嗰啲咧，或者8以上咧，係會繼續係 damage 嘅。所以個 A1C 係好緊要嘅。咁所以你一定要記住，呢個 seminar、呢個 webinar 係幫助你多啲了解，咁你就可以防禦到咧點樣係能夠控制你嘅血糖，唔會降低，唔會令到你隻腳啊麻痹啊嗰啲咁嘢。OK， 嗱，好得意人So it's very interesting because a person, all these long nerve from the spine up and all the way down to the bottom, the extremity, these are long nerve from the spine to toe. And these are that's why when they affect all these nerve, your feet will be actually feel it first, not your hand, and not your hand. It's really your feet go first. So really at the end of the day, you really have to think about, wow, if my feet not feeling well, you mean you really got to pay attention. Is it your sugars are really high? You have to well control so don't get the nerve continue to damage. And usually it's not only one feet of the nerve, one side of the feet, usually also both sides of the feet. But some people only one side of the feet feel first. But majority of them, both of them will feel already. And you will actually feel the bottom of the feet also feel kind of numb, not sensitive. So that is a common sign and symptom. 嗱，好多人唔知道咧，原來咧，當我哋神經系統咧喺個脊骨後邊嘅 spine 啦，同埋去腳咧，呢個係長嘅神經系統，佢多數係會首先咧係影響先嘅，唔係手啊，唔係啱啊啲，全部係腳先嘅。咁嘅腳咧一開始嘅時候多兩隻腳都有嘅。咁如果係咁講嘅話咧，真係咧你要注意啦，就係咪你嘅糖好高咧？你唔可以繼續俾佢繼續損毀，越損毀耐咧就越弊嘅，因為咧呢個咧係要控制到佢唔會繼續損毀咁多。咁如果你係真係有呢個叫做 Diabetic neuropathy， 能夠令到你唔會有感覺啦，又可能會少痛啦。當你有injury 嘅時候咧，你會感覺唔到喎，咁點算啊？咁就好弊啦，因為 end up 你隻腳可能俾人要即係有 injury 咧，要斬咗佢嘅。Okay, so when you have diabetic neuropathy, it causes beyond numbness, and sometimes they have pain, and sometimes they have injury. You will not know because you can feel. And when you have that, the injury is not going to feel pain, or they will have pain, but on the other hand, you don't feel the actual infection. So net result, you're going to start getting the ulcer first and so forth, and start developing, this callus and on and on and on. So end up, if that is really affected all that circulation, because the callus, the skin dry, and the ulcer will affect it further further circulation, you might end up chopping the feet. A lot of time you end up by chop the foot or the toe first, eventually chop all the toe and try to chop the feet. So in the United States, ADA, American Diabetes Association, says 73,000 people a year actually will be got the feet chopped off. Wow, imagine that's a big number. So I don't want to see any of you will be able to get a foot chop off, because when I work in ICU nurse, I saw a lot of these issues. I saw a lot of pain in the patient's eyes. So, oh my goodness, now will be on a wheelchair bound every day. Wow, that's not good. And on top of that, they have a lot of pain at the end of the day. They have phantom pain. They feel, wow, my feet is still very sore. And I can tell you, I have some gross picture. You don't want to see those gross pictures. The feet look like a mummy. That's not good. So I didn't want to share that with you, but I just share one of this picture for you, just to give you some idea already. Because you see that, you will say, my goodness, I don't want to be in that boat. Okay? 嗱，各位堂友，記住，當你隻腳越整越冧嘅時候，麻木嘅時候咧，你可能感覺唔到啊。咁你可能咧一步步咧開始腳咧就開始有少轉型啦。第一，第二咧你鞋又唔着得好啦。第三咧你開始有啲 callus 走出嚟咧，即係啲ulcer啊，即係有個皮膚嘅瘡啊，呢啲咁嘅嘢出嚟。咁呢啲瘡最弊咧佢唔好啊，唔好嘅時候咧點啊？弊家伙啦，你就會有 gangrene， 要 chop 咗個腳 ，chop 咗腳趾先咧，然後隻腳。咁喺美國咧，2010年咧係統計咧有77,300人咧係每年去斬咗腳，因為佢哋只係糖尿病嘅問題去斬腳，咁其實一個好大嘅問題嚟嘅。所以你哋記住咧，如果當你有呢個 nerve 唔係咁即係 sensitive 嘅時候咧，你真係要注重，唔好俾佢更加差。差咗之後咧，弊家伙啦，就會有好多呢啲問題出現。And so net result, think about also one more thing that people don't realize. Sometimes they also, because of deformity of the foot, they don't fit the shoes. And we notice also that maybe that's also the first sign. When your foot, your shoes don't fit anymore, is that the reason why you didn't feel the deformity? And on top of that, there's another thing that a lot of people don't realize. If your shoes don't fit you well, you're going to start rubbing. You're going to get the callus. And that result, that is actually for diabetic, you have a certain injury. That's why diabetic is good to wear the shoes with a round toe area, a lot of room in the front. So you don't have a lot of restriction, and make sure that you have cover shoes, okay? 所以糖友咧着鞋咧一定要着啲圓揼哚嘅鞋，前面嗰啲咧唔好逼住隻腳，咁令到你隻腳咧會有好多不同嘅 injury。So also you really need to control well your blood sugar to prevent the amputation preventable. Because if you have good blood sugar control, meaning that your fasting blood sugar always below 6.5, you will, after lunch, your blood sugar will be under 10 and usually under 9. All those will be very important to manage your blood sugar. I know if you're diabetic, you will have a blood sugar after lunch and dinner or breakfast up to about 10, but no more than 10. So you will have that. A normal person should be about 7, but you, because of diabetic, you will have 10. So that's a realistic target. But when you don't eat, your blood sugar will stay back to around 615 would be a good, actually 120 would be good for you, but Hong Kong will be 615. So Hong Kong people will be minimal per liter will be 615, but US milligram per deal will be 120. So that will be a good data for you to check when you are empty stomach, okay? So really important, better management your blood sugar for your diabetic is very important. You have to take care of feet every day. Now you have to get proper foot care, which I have mentioned before. What is a proper foot care, which I will tell you a little while in the end of the practically end of the lecture. You have to take foot care seriously, meaning that you have to massage your feet as well. So in a few slides later, you will see that will help you to better understand what is foot care and what you have to look at your feet every day. Is there a callus and all that? You have to wear proper footwear. Now, for people in Hawaii, that is important because I saw a lot of diabetic person is still wearing a Japanese slipper. The toe are all exposed and they hit themselves. You got infected. They end up to cut off the foot. I have a Japanese lady who years ago when I was working for St. Francis, it's really sad for her because what happened is she has been injured her foot because she wear just a Japanese slipper and she injured herself in the yard, working yard work. And that result, her foot got infected. We have to chop her foot. She is crying because she no longer do yard work anymore. And I don't want anybody to do this, with you guys. And on top of that, if you see any redness, crack, pus, ulcer, or sinus infection, you have to go to see doctor very fast. Make sure you got to be treated. Could be antibiotic. Could be you got to go to a foot doctor, a podiatrist, or endocrinologist to check it out. Because if you don't do that, you really, because of small injury, you might lose your fit because of that. And that is very, very sad. 嗱，各位堂友，好重要嘅控制血糖咧，係真係幫助你咧，唔會俾人斬咗個腳去。呢個係好重要嘅。好多人唔知道咧，如果你淨係着鞋咧，你着鞋要有即係 toe cover， 即係有個圓揼哚嘅，同埋保護隻腳趾啊。同埋咧，仲有咧，如果你任何嘅紅腫啊、發炎啊、有瘡啊，呢啲嘢全部開始新少少嘅發炎咧，你要好快脆見醫生，因為呢啲嘢咧全部係控制到。如果你個發炎係 beyond 咗呢個控制咧，你要斬咗個腳。咁其實我喺Hawaii嘅時候，當我係個 ICU nurse 咧，我係見到好多病人都係咁。有日本太太咧，佢係喺個做緊花園裏邊咧，係少少 injury 嘅，即係整親隻腳。但係佢着日本拖鞋啊，佢呢個小 injury 咧令到佢腳斬咗。咁佢喺我面前喊嘅原因就係因為佢話我以後都唔可以做到花園啦，佢隻腳係冇咗。咁你話係咪好慘咧？So 有咩事咧，好快脆你即係揾個看腳嘅醫生啦，個 podiatrist 啦，足科醫生啦，或者你個內分泌嘅醫生啦，要睇住你。如果唔係咧，你係唔想係真係令到你係呢個有呢個發炎嘅發展係真係麻麻地啦唔係咁好啦咁記住真係要保護隻腳。So remember, really have to have foot care is so important. If you're diabetic, think about really cover your toe all the time in the type of shoes. Now, also in your take care, your numbness, you have to continue to lower your blood sugar, continue to have good control of blood sugar in all effort to prevent your nerve damage. Now, what do you mean you control your blood sugar? Control your blood sugar could be dieting, exercising, measure blood sugar, but with that, there's several also including benefit. If you can able to control good your blood sugar, usually you also control your blood pressure and also your cholesterol could be also important to be also improved, because those are all linked together. That's why you drink Lowsutea will help you not only lower your blood sugar, but also decrease your LDL. Plus, also because they dump the salt out, so you also lower your blood pressure. That's the reason why some of my clients say, hey, you know, Andrew, I drank the tea, but it's also one thing I saw is my blood pressure become improved and my medication of blood pressure is better. And on top of that, you know, when you have high lipid, the lipid is going to affect your neuropathy. In other words, high lipid is related to your nerve damage also. So really, at the end of the day, you really think about sugar, lipid, and blood pressure can give you all that better benefit to prevent your nerve damage. And to do that, you have to go dieting, exercising, continue measure your weight. And if you are real obese, especially, you really need to become more conscious on your weight, lower your weight. Remember, you low 10% of your weight, you are minusing 1 point. In other words, you have A1C is 7. If you lost 10% your weight, you might get up your A1C to 6, or you're 8, your A1C could be 7. So make sure that you don't get a gigantic tummy, because that is not going to help you. You lower your weight, 10% is definitely help you. And on top of that, you also, with your weight loss, might help you also your arthritis problem, and also because your weight, you less pressure on your foot, and your feet walking much easier, your knee working a little easier, you have less chance of your knee pain, feet pain, all the things will be so much better. So really, at the end of the day, you have tremendous benefit. You will feel much more energetic, running around better, and it will be better for you. 嗱，各位朋友，好重要咧，其實咧控制你嘅血糖咧，有好多不同嘅即係好處嘅。第一 ，nerve damage 少咗啦，你個即係神經系統損害繼續少啦。咁第二樣嘢咧，如果你飲埋去糖茶去降低血糖啦，都係你仲有一樣嘢咧，你會降低你個膽固醇 LDL 係整壞你嘅心臟嘅。第二，因為佢抌啲糖同埋抌啲sodium 即係鹽出嚟咧，你降低咗咩血壓啊？咁同埋咧，你糖同埋鹽同埋 LDL cholesterol 咧，你個脂肪亦都降低，因為脂肪咧係同呢個神經嘅影響係有關聯嘅。當你脂肪高咧，你成個系統都會繼續損毀嘅。咁同埋仲有咧，你係點去降低你血糖啊？咁就重要咧，就係你要做 exercise 啦、dieting 啦，就飲埋去糖茶啦。仲要咧繼續 monitor 你啲磅重啦。如果你係個肚腩好大嘅 ，OK？ 如果你係過重嘅，你減10% 嘅磅咧，你 A1C 係 drop 1 point 嘅，呢個係真係 facts 嚟㗎嚇。咁如果你係譬如我係依家 drop 咗，我係 A1C 係8，我降低咗10%，我 A1C 會7，加埋你食嘅嘢減低你 A1C 更加低。咁你話幾好咧？咁樣樣咧都係繼續咧幫助你係一路咁整低你嘅血糖，整低你嘅 cholesterol， 整低你嘅 blood pressure， 哇！真係開心啊！即係血壓都低埋，咁你係幾好 benefit。So lots of good benefit when you lower your blood sugar, and top of that you drink Lowsutea, will lower your cholesterol, also lower your blood pressure. Wow, that would be so wonderful. On top of that, if you lower your weight, you lower A1C 1 point. So it will be all the low benefit coming along. One more thing that they were saying, and that's a lot of research actually indicate that the nerve damage basically is not cured. It's not curable. In other words, if your nerve damage, you only can control not to get worse. If you continue to get worse, that's bad, as you say, you cannot feel. And it takes a long time to have kind of progressing. You might not ever get well, but you have very little, slowly might get well if you control your blood sugar real well. So it's really, again, it's all control. Now, really have no medication. But on the other hand, they will claim there was some studies showing that you take a lot of omega-3 fatty acid may also reverse a little bit of your diabetic neuropathy. So your vitamin of fish oil can be very good for you. It's also good for your heart. So they may be one of the things that you might want to take is to actually do some more omega fish oil, 3 fatty acid fish oil can able to help you maybe with that slow down your progressions of nerve damage. 嗱，好多人知道咧，其實咧，如果你個神經系統破壞咧，係你唔會好嘅。其實好簡單，因為好多時咧，你個神經壞咗就壞咗㗎啦。咁如果你唔係你壞咗之後咧，最緊你唔好繼續壞多啲。嗱，呢個先係問題啊。If you have more damage, that's no good, right? So maybe one of the things that when you have nerve damage, there's no medication for you. But study from Journal Neurophysiology on 2015 found that if you take fish oil omega-3 may help. 咁有個 study 咧就話，如果你用啲omega-3 嘅魚油啊，咁呢個3魚油嘅嘢咧係可能幫助你咧係控制到嗰個神經系統咧損壞咧係整慢咗佢，咁你就可能會係有幫助嘅。咁所以咧係好重要咧，你要食呢啲叫 omega-3 嘅保健品啦。咁其實好多supermarket 都有賣。So it's good that you can buy this omega-3, maybe go Costco to buy. You can have that, will help you to decrease the chances to have or slow down your progressions of nerve damage because they have no medication. So that would be one idea to think about on your nerve damage besides exercising, besides decrease your blood sugar. Now, so very important, your daily food care, which is really important. Now, keep that in mind. I have some, matter of fact, you should take a picture. If when you have a camera, you can take a picture. If you have a computer, you take a picture. I will explain one by one. Now, don't think that, wow, this is picture is really, do I really do this every day? Yes, you do this every day. 嗱，各位堂友，我依家開始講解咧，要點樣能夠 check 你隻腳每一日要做啲咩嘢，去能夠保護你隻腳。咁或者各位堂友可以影張相，咁你能夠喺你電話度咧，能夠了解咧點去日常嘅個腳嘅保護嘅程序。咁呢個係幫助你好多嘅。So I hope that you guys can take a picture on your phone or whatever, then you can able to at least start carrying that. Now, very important, your foot has to wash daily. Make sure it's clean. Make sure it's being washed clean, especially if you're in Hawaii. I know everybody wear Japanese slippers, or in Philippines, the same thing. Excuse me. You really have to wash your foot very, very well. Do not go with the foot with all the dirt in there and not necessarily keep it clean is not going to be good. So keep that in mind. Very, very important. Keep it clean. 嗱，每日你要洗腳洗得好乾淨。呢個洗乾淨咧 ，make sure 咧嗰啲腳趾罅、其他全部都要洗乾淨嘅。咁變咗同埋咧，因為如果邋遢咧有咩啊微菌喺度啊，咁每日咧你腳出街唔好着啲涼鞋咧係腳全部係突咗出嚟嗰啲咧係對你唔好嘅 ，for 呢個糖尿病者啊。咁所以變咗咧一定每日洗乾淨腳 ，OK？ So secondly, every day you have to dry after you wash your foot. You have to dry the toe area, especially everything will dry. You have to really dry up, don't get a moisture. Because moisture get also fungal growth is not going to help you on your foot. Because when moisture, you actually give them any water and bacteria will give them growth. So that is not good for you. So you really have to dry your feet extremely well, especially the toe area. Between the toe, you have to dry real well. 嗱，你洗完腳之後咧， 一定每一笪地方咧，尤其是腳趾罅咧，要乾乾淨淨。因為如果你有水分咧，係好多真菌咧，係可能喺嗰度咧生長嘅。咁真菌咧就生長之後咧，咪整爛隻腳啊，咁啊弊家伙啦。所以一定要整乾佢，唔好整到好即係唔係濕濕地喺度唔 good 嘅，一定要做呢樣。So make sure dry your feet real well, especially toe area. Now you got to examine your foot thoroughly. Now what do I mean examine through? You have to at least feel the feet area, like here, any lump, bump, and also is there any kind of temperature change? Why temperature change? Because if that infection, that area become real hot. And the problem is because you're diabetic, you already have some nerve damage, you might not feel the pain. You might not even feel anything there. So with that, you feel hot, you feel redness, all those are signs of infection. So you really have to feel that area. Is there any bump, any pain, and also any temperature change? 嗱，各位堂友，你隻腳咧，因為你已經冇乜感覺啊，可能咧你未必 feel 到有個痛啦。咁你好重要咧，係要睇下佢係咪好熱嗰笪地方啦，有冇嘢拱起咗啦，有冇發炎啦，呢個係好重要嘅。記住睇呢樣嘢，咁你就好早咧快啲，哇！原來有發炎喎，咁你要睇醫生去食藥啊，或者去查啊，咁呢個係好重要嘅。So important to understand is there any bump, any feel lump, redness, and so forth. Now, also, you have to look between the toe and check any toenail, any kind of redness infection. Because most of the infections are right in this area, all that in this area are always the new places that are infected, especially the last part of your toe. And a lot of time this is the most common area, with this type of infection. So keep that in mind, very important to check between the toe and check the toenail. 嗱，每個堂友記住，你要睇住每一隻腳咧，最緊依地方腳趾罅或者腳趾尾咧，同埋個腳趾公咧，呢度咧全部啲地方係好容易發炎嘅。咁要睇下係咪有邊有發炎嘅地方咧，要睇個紅腫咧，尤是好多人有香港腳有真菌咧，呢個就係最容易發炎嘅地方，所以一定要睇清楚。So also you have to file the toenail straight across, not to cut deep, because a lot of people like to cut the toenail really deep, and you can injure this area, then you get infected because of the fact that you cut it too deep. So a lot of time it's good to also not just cut, but use a toenail filer to file it. Will give you the same effect, but less chance to injury. The key is less chances to injury. 嗱，每一堂友咧，記住，當你剪腳甲嘅時候，直剪或者你揾個錯即係嗰啲nail 嘅腳趾甲嘅磨啊，去磨平佢，就唔好係剪得好深。剪得深嘅時候一損毀咗咧，你就弊家伙啦，會發炎，咁你就好難好啦。So the thing is also we have to check dry cracked skin. Now that is a common, not only just diabetic, pre-diabetic person is at the same thing. I have so many pre-diabetic patients now came back to me and said, Andrew, I'm on a pre-diabetic. How come my skin is so dry? I look at the skin. Wow, their bottom is very dry. And notice the A1C is only 6.5, 6.4. I'd be very, very simple, not very, very bad diabetes, but they already have that problem. So checking dry skin is so important. So how are you going to work with the dry skin? Put cream. Every day you have to massage area, putting cream. So that is something that you have to do every day. Cream, prevent dryness, prevent crack, prevent infection. So you have to do this every day. Okay, 各位堂友，好重要咧，好多人咧以為哇，我唔就係糖尿病先有呢啲啊，唔係。因為好多我哋嘅前期患病嘅堂友都話俾我聽 ，Andrew 啊，我隻腳好乾喎，點解咁嘅？尤其是腳踭嗰笪地方咧，哇好乾喎。咁其實咧，原來前期咧都有同樣問題，當然佢同樣問題唔係咁深嘅問題，但係都開始。 咁你每日咧要 massage 下隻腳啦，擺 cream 上去，令到啲腳板啊、腳踭啊全部好濕潤啦，即係唔好滑潤啊，唔係濕潤啊，滑潤啦，唔會有嗰啲 crack skin 啊，好重要。當你有 crack skin 嘅時候，就咩啊？發炎啊，所以你發炎咧就麻煩啦，咁你就好唔好啦？所以你唔想令到你所有嘅皮膚係唔會有乾嘅，同埋仲有好多時咧隻腳咧腳眼嗰度咧會痕啊，乾嘅痕咧，你仲有咩啊？拗啦，拗咧就咩啊？損咗啦，又發炎啦，所以其實一定用個，如果你痕咧唔好拗，用啲 cream 搽咗佢，咁佢就唔會痕噶啦，因為痕咧就多數係因為你腳係乾淨。So a lot of people also complain that, oh, my foot is very itchy, especially ankle area. A lot of time in diabetes, because circulation is bad, the skin has become very dry. And the skin dry, they got what? Itchy. And the itchy, what's going to happen? You scratch and infect it. No good. So you need to put cream on the every day. By the way, it's not once a week, twice a week. No, it's every day. Put cream on. You got to get a habit because this lifelong disease. When you do it every day, you do extremely well with the foot, okay? Now, also, you have to examine bottom of the foot. And a lot of people don't realize I have to expand bottom. How do I look myself? On the bottom of my foot? No problem. Put a mirror there. And then you put a mirror, at least look at it every day, see any ulcer develop, and you have able to see whether your foot is getting injury, or is there any crack, so you can massage the area, put cream on the area. You have to see it every day. I can tell you, a lot of my clients, because they fail to look at their foot every day, they end up actually has a big ulcer there without knowing, because they can't feel it, because the numb of the nerve damage they cannot feel. So they end up what? Whoa, the infected come around and they lost control of the infection. They end up cutting the foot. I have another lady, her name is Mrs. Fong, years ago in St. Francis. Her first problem was, actually, she was diabetic, by the way. The first problem is she lost her foot was because of that. She basically failed to recognize her leg has a little ulcer, eventually spread up, eventually she had to chop out her feet. She stayed in the hospital for 6 months. Imagine that, that's terrible. They chop one of the foot and they end up chopping the other foot. Wow, I think it's so suffering. So forget that one. Start early, start control, you don't get into that issue. 每日你要係真係睇下隻腳，腳板底喎，點睇啊？唔係好簡單嘅，其實你拎個鏡咁我睇下個腳咧係睇到嘅。每日要 examine， 如果唔係咧，可能你個細 ulcer 睇唔到，就變咗大 ulcer。大 ulcer 變咗 end up 就 infection 冇得控制，要斬咗個腳真係好慘。當我近時 IC 做嘅時候，我有個病人佢姓方嘅，咁佢個問題就係好細嘅 ulcer 做大咗之後冇得 control 佢斬咗個腳，咁你成世坐喺嗰個輪椅嗰度，你又幾陰功啊！咁啊希望你唔會 end up 呢樣嘢啦。所以買個鏡好簡單，睇下個腳。有啲人仲買個長鏡嚟睇嘅，因為佢話好難我 band 低啊，就係老啦睇唔到啊。咁你可以揾個長啲嘅鏡嚟做，所以變咗亦都可以嘅，一定每日要睇下。Some people say also, I can't bend down to look at my foot. No problem. You can buy a mirror extended to look at it. That would be good too. So think about that. Or maybe help your partner, like your wife, your husband, to look at your feet every day. That can be done. If you cannot, just get a mirror to look at every day. Now you have to track your finding. In other words, if you find a problem, you have to look at it, know how big it is, write it down, talk to the doctor, so you can get very fastly understand what happened. 嗱，每樣嘢睇咗之後，你要寫低，咁你知幾日發現，幾日開始發現，咁你就快脆話俾醫生聽，咁或者可以好快就檢驗咧，咁就希望你唔會 end up 就即係俾人斬咗腳就好慘啦。咁嗱，我頭先咧再講咧就係常見嘅大個問題喺邊度發生咧，咁呢個可以講下俾你聽嘅。So I'm going to start talking about what is the common people actually examine and what I also myself saw all the time. Now, if you have looking at the feet, this is the common thing that you will have. The bunion and the toe over here always have a little knot. And this knot is corn. It started with a corn first, and that's a common thing. Then, and also this two toe, small toe is also a common infection area. And on top of that, this one is because of the bunion. And also when you hear you have a lot of pressure, you have a crack. Also here and the back is all the common area first sign. You will always see that. And so you have to really look at that very commonly. 呢個係我見到常見嘅問題，亦都我見過好多次啦。咁其實第一樣嘢，你腳眼呢度咧係好多時咧，因為你個鞋好大壓力大啊，呢度整損咗咧。如果你糖尿患病者就好難好啦。咁呢個係好慘嘅，因為好多時啲女士咧着鞋咧係好硬啊呢度，男士都係，女士係特別多嘅，同埋呢個咧亦都係特別多嘅，就係呢啲。有個首先咧有個腳眼腫咗出嚟之後咧，你鞋嘅磨磨亦都有，同埋個toe呢個腳趾尾咧，呢個成日都係有呢個問題嘅。咁呢度講咗啦，咁呢個腳呢個底呢度亦都係，因為你壓力好大咧。咁你如果你鞋咧最好有啲好嘅鞋墊咧，軟啲咧幫助你啦。呢度兩個地方亦都係成日見到有發炎嘅地方嘅。So also another thing, that's why I said it's important to buy shoes fit better with a round one toe rather than a very, very tight toe. That is not really that good. So that is actually very important. Now, another thing too is make sure this is the area you have, make sure to keep watching because this is a common area. You rub, you get infected, or you form callus in this area. This is a common area to see that. Plus, this is the more important is your shoes. If you get a little lump here and you can, corn here and then start infected, that would be very sad. As I mentioned, the toenail is not good if you cut it too deep and your dry skin at the back. That's why you have to keep, excuse me. That's why you really have to keep the skin not dry and able to make sure that this is continue to be moist, no callus, and plus your toe here and here has a common ulcer. This is usually majority. I saw my previous nursing experience. A lot of my patients, they always start off here and here. Also here is the place where they start losing their foot. So really, you got to take this serious because I saw so many. I have some picture, but I don't want to share with you because that picture is so gross. A lot of people get sick and they throw up when they see it. But that is the real picture of real person. And at the end of the day, you don't want to be in that shoes, okay? So 各位朋友記住，呢個腳眼呢度咧，好多時發炎一磨啦，你後面乾啦。呢度有個腳眼彈咗出嚟啦，同埋你腳趾咧太過深啦，有 infection 啦，同埋腳後邊咧好乾啦。但係好多人咧個 ulcer 就係呢度開始發展嘅，同埋仲係呢一度啊，呢三笪地方係好常見嘅。咁記住，如果你唔 take care 佢咧，真係弊家伙，因為呢啲人咧，當你唔 take care 好多時咧，會有一個好大嘅發炎機會。當你一發炎機會咧，就會好大問題。同埋咧，你嘅發現咧唔會好，你割咗腳，咁大家好慘啦。咁嗱，各位，依家總結咧就第一，記住，如果你糖係高嘅話，咁就會令到你一定有好多不同嘅後患症出現。你腳咧就會係變咗好冧啦，即係麻痹啦、痛啦，撞咗、傷咗，你唔會好嘅。So in summary, it's very important if your high blood sugar lost control and continue to be very high. One of the serious complications is your numbness of your feet. You might have pain. You might have you might injury without knowing. It doesn't get well. And when that don't well, it's a serious issue because you might end up chopping your foot. Secondly, you have long nerve body damage because the body damage is usually from your spine all the way down to the foot. And you will get, if you continue high blood sugar, this long nerve will affect the first. That's why your feet will be feeling first, not your hand and arm. 記住你個長嘅神經系統咧，多數係開始損壞先嘅。當你糖係高，因為由身體個背脊嗰個spine 落去隻腳嗰度嗰啲長嘅神經系統咧就會開始損壞。咁所以咧多數係腳會 involve 先，然後先去到身手啊嗰啲地方。So really always the long nerve affected first, and then affected the next is really your feet, is not your arm. And diabetic neuropathy usually caused by numbness and pain, and also in the injury, and sometimes even have deformity of your foot. And that's usually numbness are the most common. Second is pain and always injuries, okay? So 如果你係有呢個糖尿病嘅神經破壞咧，你係多數首先係冧先嘅，多數係咁，同埋兩隻腳都係冧嘅，可能一隻腳兩腳。咁好多時咧，仲有咧係轉型嘅你隻腳 ，OK？ 咁啲鞋唔係咁 fit 啊，呢個就要你自己要了解下。So very important when your shoes doesn't fit anymore, you better start paying attention. How do you really prevent your amputation? It's really is preventable if you continue to lower blood sugar, meaning that your blood sugar will continue to be at 6.5 milligram per deal, millimole per deal, or 120 milligram per liter per milligram. So very important, you really have always control your blood sugar. Don't get it to be high. Make sure it be 120. Your after eat should be under 10 for Hong Kong, and be under 140 or 160 because you're diabetic, you'll be 160. Keep that blood sugar continue to be low, not continue to long blood sugar. A1C should be under 6.5, or 6.4 would be good. So these are things that you really control yourself to prevent amputation. 好重要糖友，一定要咧降低你嘅糖，繼續度，繼續去 exercise， 繼續 diet 去控制血糖咧，咁你就唔會俾人斬隻腳啦。咁而變咗嚟講咧，你點控制糖咧？就重要點咧？就係 diet 啦、exercise 啦、個磅數減低啦，咁同埋咧令到你係知道係能夠繼續去 measure 自己嘅血糖啦，飲去糖茶啦係好重要嘅。飲去糖茶有3樣都降低到嘅。你飲咗去糖茶係降低血糖、降低你嘅 LDL、降低你嘅blood pressure、降低鹽啦，同埋 detox 好緊要。所以繼續飲呢樣嘢。So important to your effort is very important to lower your blood sugar, to exercise, to dieting, weight control, and drink Lowsutea to make sure to lower your blood sugar, LDL cholesterol, and blood pressure. And nerve damage, by the way, has no medication, cannot really, it doesn't treat. It's a slow progress. Maybe you can able to take some so-called omega fatty supplement that might help, but it slow down the progress. So you gotta keep that in mind. It doesn't have medication. You just got lower blood sugar, maybe omega 3. 記住糖有一定要降低血糖啦。咁你個 nerve damage 就好啲啦。第二樣嘢咧就你唔會冇藥食嘅，所以咧一定要係降低血糖，或者用個 omega 3。omega 嘅supplement 咧係幫助 slow 個 progress， 咁好重要啦。每日要繼續咧係咩啊？將你嘅日常去護你隻腳，整乾隻腳，每日睇隻腳 ，make sure 咧你唔會常見到嗰啲喺腳踭啊、腳底啊嗰啲 injury 咧，一定要好快去 take care。So very important, you really have to take care of your foot every day. Massage, oil, make sure it's smooth, no crack, and also look at all the common problems I talk about in the diet, in the picture. So then you can prevent yourself not to get your foot cut off and improve your numbness. Okay, now I'm going to talk about 3-gram carb fluffy waffle. Then you will enjoy that because it's very easy to make. It's all mixed together. And it's delicious. You can see how nice the waffle is. Looks really just like the same regular waffle, but only 3-gram carbs. OK， 各位依家我哋可以講輕鬆啲啦，可以做個 waffle 餅，係3克嘅啫，哇！真係好正。咁嗱 ，take 一個 picture 先。So everybody, can you take a picture? Because this is almond flour. Almond flour and also help you to get the picture with baking powder, cinnamon gum, or arrowroot powder, and then a little bit salt, and then you have whipping cream or heavyweight cream, 2 tablespoons of coconut oil, and 3 eggs. That's how you make it. Very simple. Take a picture now. Everybody take a picture. And you can able to make this real easy. And I think you're going to enjoy that. The reason why I give this in waffle to you folks is a lot of people say, well, I have nothing to eat. It's very boring life. It's about diabetic. Does it? Not really. You can able to have lots of fun. And I will share with you all kind of great diabetic recipe or pre-diabetic recipe is the same thing. Lower your carb diet, help you enjoy life, and you won't get bored. Listen to me more on the diet, on the thing, because I try all these myself and it works and I love eat, okay? So this is going to be real good. So I'm going to play the, oops, sorry. I'm going to play the, Hi, I'm Andrew Lowsutea, President. Hey, it was wonderful to have a wonderful weekend. We're now cooking something really interesting, breakfast. Now, the reason why I'm doing this is because a lot of the my pre-diabetic, diabetic client was still asking, Andrew, last time you taught me on almond bread. It was very delicious, was good. Now I have bread in the morning. I can make it for peanut butter. I can make it with butter or what have you to make it interesting. And sometimes they always even as good to put some avocado with some onions. So make the breakfast so interesting. They also put some eggs and stuff like that. For lunch, they also put like chicken or tuna mix, some mayonnaise and some lettuce, and said, wow, that's delicious. Even a lot of people even use hamburger patty. So make the whole lifestyle of getting 2 gram carb. After eat it, they don't even spike the blood sugar. But everybody said your 90-second bread was excellent. You know why? Because truly take 90 seconds to make. And they said, wow, Andrew, this is really good. You got to keep making more of those things, because for them to make 90-second bread, and they can able to put cheese over it, they put the ham over it, they also put like avocado with some tomatoes. Wow, make the life so much better. And everybody said, you know, being diabetic now is no more longer as a really suffering, nothing to eat. There's a lot of things to eat, and you can make all kind of stuff to make it good. So this time, they keep asking, give me some more, give me some more. Well, no problem. I will give you more. And this time, I'm giving you a fluffy waffles. And this waffle is only 2 gram carbs. How you like that one? Okay? So, hi, 我係 Angela Lowsutea President。你好，嗱，我哋好多堂友咧話咗俾我聽啦，佢話Andrew 好嘢喎，你又俾咗2 gram 嘅杏仁麵包。咁我依家食杏仁麵包食得好精彩啊，因為咧又可以搽唔淨止係花生醬啦，又可以搽不同嘅牛油果上去啦，或者加啲小銀仁上去啊，不同嘅嘢又可以加啲 ham 啊，哇！佢係朝頭早好精彩。咁同埋咧食完飯都係唔夠2 gram 卡，亦都冇上去咧，令到啲血糖高嘅。咁佢哋覺得好靚。咁就上2個禮拜前咧，又有一個係90個 second 90秒嘅麵包，呢個咧係8 gram carb，佢哋個個都話好正。有好多整完之後咧，又俾啲自己老公啊、太太食過啊，佢話哇一流啊，嗰啲血糖又唔高嘅。咁亦都可以擺芝士啦、ham 啦，或者牛油果啦，不同嘅嘢上去咧，哇！佢哋個個都話好 enjoy， 咁個個都話喂 Andrew 俾多啲靚仔嘅 recipe 啦。咁今次咧，我係整 waffle 俾你。嗱 ，waffle 係 good 嘅，因為只係2 gram carb 嘅。So today the 2 gram carb is easy to make because I'm trying to make all our recipe, all the research is all just mixed together. You can prepare that within 10 minutes or so and put it down into your waffle machine, and then you know what? You are done, and that will be delicious, look great. So the ingredients very simple. One, we have 1 cup of almond flour, and then we have 2 tablespoons of baking powder, 1/4 teaspoon cinnamon gum. This is cinnamon gum. Now, if you don't have cinnamon gum, you can use arrowroots. It's the same thing, but I have cinnamon gum, so I use cinnamon gum. And then you have 1/4 teaspoon of salt. And then you have 3/4 cups of the heavy cream and 2 tablespoons of coconut oil, and then 3 eggs. That's it. Now first you mix 1, 2, 3, 4 these 4 things, and then mix the rest. That's simple. Okay. 嗱，各位朋友，呢個咧就杏仁粉係1杯嘅杏仁粉，然後咧。就係2個 tablespoon 2大匙羹嘅 baking powder， 然後咧就1個4分1羹嘅匙羹咧，呢個叫做 cinnamon gum， 呢個睇到 cinnamon gum。嗱，點解用 cinnamon gum 咧？就因為佢咧係好少 carb 嘅，咁同埋咧就如果冇咧就 arrowroot 都得 ，arrow 一個箭嘴嘅 arrowroot 就得。咁然後咧就係half a teaspoon of salt， 咁呢1、2、3、4咧 mix 同埋咁嚟咗先。然後之後咧，再 mix 咧就係嗰個2個大匙羹嘅coconut oil 啦，然後咧就3隻雞蛋啦，同埋咧最後就擺呢個4分3嘅杯嘅 heavy cream， 咁啊 mix 晒佢，然後就擺落呢個waffle 嗰度就得㗎啦。So it's very simple. So I'm going to start first. I'm going to put in my almond powder and follow with my, slowly going down and just keep mixing. Getting my, baking powder in there. Let's keep whipping. Okay, let's get everything in. Okay, let's see. Okay, good. Okay, and then, okay, now I'm going to do this. And then next thing, I'm going to get my cinnamon gum, okay? Okay, again. You see how easy? I just use a big bowl. I'll just do this. And then what I do is I use salt. And then I put salt in there. Again, so pretty much done like this. You see? Just keep mixing. Now, next step, what I will do is I will start making my coconut oil. Okay? This is my coconut oil. Oh, my mind. Just mix like that, making oil. And now I'm going to put my eggs in. Okay, I'm going to put eggs. Okay, it's very easy. You see the mix? I can't come out pretty good. Mix all together. Okay, you just do this real good. You just hold on to this. Now, you notice it's getting more liquidy and easier down the road. It's easy to basically very easy to be more liquidy, then you can pour it into the oven and the waffle oven. It's really easy. You see how nice? That's how you do it. Okay, and then pretty much done. And then we will now put the cream on. Okay, is that nice? Come out pretty good. Now put the cream on. Okay, wonderful. Now you come out is more liquidy now. You can see 我哋 mix 晒啦，咁多樣嘢，逐個嚟咧 mix 晒就可以做到個 batter 出嚟，好鬼靚仔嘅啦，幾靚啊！繼續啦，依家睇下啦，繼續做下咁就好容易差唔多 mix 晒噶啦。You see how nice, easy to do. Okay, 嗱，我用咗最多數咧，全部做晒都唔夠5分鐘啊！記住5分鐘搞掂。It's only altogether it's only about like 5 minutes. It's very easy, very very easy. So we just do that very very easy. Okay, you see how nice? So we are pretty much done, I think. So now what we'll do is pour this in to our preheated waffle. 我而家咧可以放落去個 waffle machine 嗰度，可以睇下 waffle， 係咯 waffle machine。咁我而家開始，嗱你可以 spray 啲 oil 落去嘅，咁我都spray 咗 oil 㗎啦。其實我已經 spray 咗啲olive oil 落去嘅，咁而家可以去啊 spray olive oil。OK， 咁都差唔多啦，咁我就閂埋佢 ，OK， OK 得 ，OK good， 咁我而家閂埋㗎啦 ，OK good，oh wonderful，good， 呢度，咁啊焗大概5分鐘 ，so we most likely depends on your waffle machine. It take about 5 minutes, and the recipe make between 3 to 4. Waffles. So we'll see you in a little while. We'll turn off the camera now. We'll see you in a little while. 咁啦，焗5分鐘，焗完5分鐘 ，depend 你 waffle machine 啦。呢個就5分鐘嘅，大概5分鐘啦。咁我睇下係幾多分鐘。咁遲啲咧翻嚟做好咗之後再俾你睇。一陣間見。See you later. Hi, I'm Angela. I'm back. Wow, the waffle machine, it's a thing and it's ready to go. Let's take a look how it looks like. Whoa, look at this. Is that nice? Wow, it's wonderful. Let's take our waffles out and see how it goes. 嗱，呢個 waffle 咧好靚仔啊，睇下幾靚。咁啊，試下有冇食先。OK， 咁啊擺低呢個。咁你可以擺牛油啦，你可以擺不同嘢落去啦。有少少like raspberry jam 啦，都 OK 嘅。你睇下幾靚 ？How's it? Is it? 哇！呢個 waffle 好靚喎，你睇下幾好咁啦。咁我traditional 咧就擺啲牛油喺度嘅。So I usually love to have my waffle with some butter. So let's see how it goes. Okay, see, let's take a look first. 嗱，呢個擺啲牛油落去就好好食嘅，咁試試啦。I will try out. It smells very nice， 好香啊。一流，味道咧好滑，同埋咧係一個即係同舊陣時普通嘅麵粉 waffle 咧，呢個仲好食過佢，因為佢夠滑嘅。Okay, this waffle tastes really wonderful because it compared with other waffles like the typical white flour waffle. This is actually tastes better because it is much more smoother. It has a real good taste in the sense of the taste of the waffle itself. If you put a little bit jam on it, it will be also wonderful. So you put, I would suggest low sugar jam. So whatever you have or low sugar syrup, that can be, make sure that you keep your carb low. So you can do some of those. If you don't want to, like me, I don't use syrup. I just use butter, and it tastes absolutely wonderful. So enjoy, and this is your wonderful fluffy waffles, 2-gram carbs, and have a wonderful weekend. Okay, we'll now go back on answer questions. Remember, when you lower blood sugar, you have to have good dieting. You have to have exercise. You have to lower your weight, so you decrease the diabetic risk and lower your chances of feet become numb and continue to be worse. So keep that in mind. 嗱，記住，我哋控制血糖一定係要做我哋嘅 diet 啦，要 exercise 啦，同埋仲有去 lower the weight 啦，同埋仲有飲去糖茶，因為去糖茶幫助你真係降低血糖啦、LDL 啦、血壓啦，咁幾樣嘢咧幫助你係減低你個糖尿病風險，同埋咧仲有幫助你咧係減低你個你個神經系統嘅破壞，咁你就唔會繼續係 worse 落去咧，就唔會話你腳會冧得好緊要啦。So very important, continue drinking Lowsutea because Lowsutea definitely help you to lower your blood sugar, your LDL cholesterol, and also your blood pressure. So that become a very important thing to have to manage your better blood sugar. So some of the questions, thanks Eugene. They said is someone asked me if you put lotion between my toe, is it good? 有個 question 啦，就係話我係咪應該擺 lotion 喺啲腳趾罅嗰度啊？一定係好重要添。點解咧？如果你腳趾罅咧，好多時咧就係乾，就係嗰啲地方乾嘅。咁你擺 lotion 落咧就潤翻佢咧，咁佢唔會有 crack 啦，亦都唔會幫助你啲crack 咧係有發炎啦。咁呢個 lotion 係好緊要喺度。咁好多時咧，尤其依家咧好多醫生咧俾我哋個即係腳嗰個腳臂腳踭嘅地方咧好乾嗰啲咧，佢俾好多好重嘅 Vaseline wax 啊，係好油嘅。咁咪幫助你咧係可以幫助你係將個地方即係能夠好滑啊。咁亦都有個提議咧，有啲好多醫生咧就話不如 make sure 你着有粒襪喺度啦。咁就索咗你汗啊，唔會咁容易 injury. So very important. A lot of the doctor now they actually said I will put or suggest a very heavy sort of heavy wax like Vaseline wax type of wax to smooth out your heel. So make sure that your heel, your toe are continue to be moist. It doesn't get dried up so it can cause infection. That's so important. So remember that. Now also. Another question we have is they says cinnamon gum. Cinnamon gum actually you can buy from baking store or arrowroot. You can buy baking store. So this two item is you can pick up baking store. It depends on what they have. 嗱，呢兩樣嘢咧，其實咧喺嗰啲即係專係賣煮嘢食嘅，即係賣煮餅嘅地方就係呢個。咁呢個 cinnamon gum咧，其實係個我知我煮咧，佢係個 razor 嚟嘅，即係將佢整到去會蛋糕個 binder 應該係咁講。咁佢係呢個咧係會幫助個 binder。咁呢個係用呢個方法嚟做啦。咁同埋佢係好少卡路里嘅，同埋好少個 carbs。咁所以碳水化係好低嘅。咁呢個就係佢用呢個咧係會用 cinnamon gum 係會好，因為佢 low carb 曬低。So the reason why I use cinnamon gum is binder on top of that is low carb. So that's why we use that. So anyway, any more questions? If no more, I appreciate very much you're on your busy weekend. Continue to listen to my webinar. I hope you learned something. If any further questions, make sure you give us a note. We'd love to continue to answer you. And you can write to me at andy@wafang.com and look at our website if you want to. We absolutely would love to help you with your diabetic problem. So if not, then I make sure to see you next week. But keep that June 26th on a Saturday will be a very good webinar for everybody. The reason is that webinar with Dr. Simon Au talk about COVID-19 and related to diabetic mellitus is very important webinar because it show you when you are diabetic, why so important you gotta have your vaccine. It helps you tremendously. So he'll explain everything why that is important. So June 24th, I believe is, I think it's June 24th. That's the day, June 26th, Saturday. June 26th is the day. So make sure you allot that time to listen to Professor Simon Au around this important webinar. That will be in Hong Kong time, 3 p.m., Hawaii time, 9 p.m. So it is slightly later, but it's important webinar。各位朋友記住咧，我哋喺6月26號咧，星期六3點鐘下晝，我哋有個 有個網上講座咧，係關於糖尿病同埋 COVID-19 點解要打要點防禦啦，同埋點解要打個 vaccine 啦。呢個係好好嘅節目嚟嘅。咁希望你寫低個日曆嗰度，6月26號。咁希望你大家一齊聽。So thank you very much again. I'll see you folks. Have a nice weekend and enjoy, if you could, enjoy your fluffy waffle. I hope you can enjoy the waffle on Sunday, and that will be wonderful. Have a nice day. You take care. Bye-bye.